the technical aspects. And it really is our pleasure to introduce our presenters for today. Janet Fine is the project director for Northeastern University's Vicarious Trauma Toolkit project funded by OVC. Janet is also a senior consultant for Organizational Resilience International, LLC. She serves as a national training and technical assistance provider for the State Victim Assistance Academy Resource Center at the National Center for Victims of Crime. Janet's direct service and leadership positions in victim services and children's advocacy centers at the state and national level for more than 30 years include serving as the executive director of the Massachusetts Office for Victim Assistance and as an executive board member of the National Children's Alliance. Janet's extensive experience also includes serving on the National Crisis Response Team at Ground Zero after 9/11. Janet consults and trains throughout the U.S. and internationally on victim rights and services, development and operations of CACs, Children's Advocacy Centers, and vicarious trauma. In her many positions, Janet has provided foundational and ongoing support for programs addressing vicarious trauma for victim services providers. And if that doesn't keep her busy enough, Janet is also on the faculty as a part-time person at Northeastern University, and she also serves on the World Society of Victimology's UN Liaison Committee. Lisa Teason is a consultant for the Vicarious Trauma Toolkit project and content expert for the State Victim Assistance Academy's Training and Technical Assistance Resource Center, both funded by the Federal Office for Victim of Crime. For over 35 years, Lisa has assisted individuals and organizations impacted by trauma through advocacy and teaching, as well as staff and program development. Examples include co-creating the Advocacy for Women and Kids in Emergencies, Awake Project at Children's Hospital Boston, the first domestic violence response in a pediatric healthcare program, and as a co-founder of the Domestic Violence Intervention and Vicarious Trauma programs at Beth Israel Deaconess Medical Center in Boston to strengthen individual and organizational responses to the impact of trauma exposure. Lisa is a longtime clinician and advocate. She is also senior consultant with Organizational Resilience International, LLC, and has a private counseling practice in Brookline. And I think many of us in Massachusetts have been able to really benefit from knowing Janet and Lisa over many years. So we do thank you, Janet and Lisa, for the amazing work that you do, and we're really lucky to have you here today with us. So with that, I will turn it over to Lisa and Janet.
Great. Thank you so much, Tina, for your welcome. And thank you, everybody, for signing on today. Janet and I have worked out our system here so that you will see the person who is speaking. And I'm Lisa, and I will start us off, and Janet will follow. So we are really pleased to be here today with you talking about the long time work we've been doing in vicarious and secondary trauma, and now this organizational work that we've been doing through the Vicarious Trauma Toolkit. And as we move forward through these PowerPoints, we'll be reflecting on work that we've done over quite a period of time, both on the ground here in Massachusetts, the way that we know many of you who are in the audience, and also in the organizational work that we've done here as well, and now across the country. So with that, we will let you know what our objectives are today, which is really to look at the relevant terms and concepts regarding the work.
Yes. It looks like we just had a little bit of trouble with the sharing the screen. I apologize for that. Tina's trying to figure out sharing it from her computer.
All right, I will keep going. I'll let you know that we're going to talk about the terms and concepts regarding the work-related trauma exposure. We'll be talking about the organizational impact of vicarious trauma and a comprehensive approach to becoming what we call vicarious trauma-informed, and identify tools through the toolkit that we help develop that should be able to help you along with your colleagues in addressing these issues. And we've been excited that a number of you have been participating with us both in the survey that we did a few years ago and in working with us on learning more about the toolkit and assessing your organization's readiness. And Janet will be talking more about that in a little bit. So let me just say also that while we, oh, thank you. So we're on to the quote, slide 3. And that while we have worked with many of you one-on-one, we have certainly always held the importance of having organizational response. And we were very excited that the Office for Victims of Crime agreed with the importance of addressing vicarious trauma through organizations, not just for us on our downtime, that we should take care of ourselves. So we'll be talking about that more specifically, but I want to say that up front, that we in our organizations and the organizations themselves bear responsibility here. And you've already talked about that in the last session as well, about being trauma-informed and really addressing organizational trauma. You've heard about the neurobiology of trauma. I know this has been a rich series of webinars, and we hope that this final one is really useful to you as well. So we love this physician's quote, Rachel Naomi Remen's, the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. So we think a lot about this experience of getting wet in the work. Sometimes getting wet is a good thing, sometimes getting wet is not a good thing, but it's really important that we recognize that the work does impact us. Now, as I mentioned before, you heard in detail from Erin Miller from Newton Wellesley about the importance of taking a closer look, really taking a closer look at trauma. You can move on to the next slide. We will not go into as great a detail today in trauma, but suffice to say that a traumatic event is more than a stressor. It's more than a stress that we react to. It's the trauma, it's the threat to one's safety, security, and sense of being that we're really looking at, and not just trauma that many of us have experienced ourselves, but at the trauma we experience vicariously through hearing directly from survivors, seeing their records, hearing their stories from colleagues. We see trauma through the lens, through the eyes of others every day. So what is trauma? It's the direct experiencing or witnessing of actual or threatened violence or serious injury or death. To be exposed to a trauma, it has to involve the direct experience or witnessing. But in fact, what we have learned, and many of you know this already, that in 2013, for the first time, the American Psychiatric Association began to really recognize the risk of indirect exposure by including homicide survivors through our work-related trauma exposure. So in fact, we could experience through our indirect contact with a violent event, we could experience post-traumatic stress disorder ourselves. Now, it doesn't mean that every one of us is going to be diagnosed with PTSD, but what it does recognize is that those of us with a steady diet of traumatic events, being exposed to traumatic stories, it's a recognition that it's bound to have some negative impact. So we want to be very cognizant of that in a different way. We've moved on. Sorry, I'll have to work together. We're on to the trauma slide. We've just covered the next slide. Yep. So this is the slide I was just talking about, where we experience through indirect contact the violence or threat that others experience. And that's in our work. And that's really important to hold on to. So the language, the next slide, we're really looking at but Janet and I, and along with you all, have been talking about for a number of years is this exposure to work-related trauma that's called many, many things. And we have both direct and indirect exposure, right? So in addition to being at risk for PTSD, which is used both with direct and indirect exposure and used by a lot of people synonymously with other terms, there are these other terms that we all are using: post-traumatic stress symptoms, critical incident stress. But for the indirect exposure, we use VT, or vicarious traumatization, secondary traumatic stress, indirect trauma, empathic strain, compassion fatigue. You all have heard the whole alphabet soup, so to speak, of terms. And you can think for a minute, in your organization, what term do you use? And do you understand what other people are talking about? And so I'll move on to the next slide, because what's in the essence, or at the center of this for us, is really naming that the work has an impact on us, and that whether we're exposed directly or indirectly, we are impacted. So you look, traumatic stress, we might have, in the face of experiencing a traumatic event, we might have extreme emotionality or absence of emotion. But if it's vicarious and I'm working with a trauma survivor who's experienced trauma, I might be overly involved, or I may actually want or feel inclined to avoid that survivor because of her or their experience. Similarly, we could actually experience our own hypervigilance or jumpiness in relation, not only to a direct trauma experience, but also vicariously. Flashbacks, more likely to happen if we've experienced a direct trauma. Vicarious trauma, we still may have intrusive images. We may keep hearing someone's story or a threat to someone over and over and over. So I want to dig into these terms just a little bit more, because the exposure to these traumatic events secondarily can show up in different ways. The terms can be different, and I don't want to get too hung up in this. What we do see is a change in worldview. We all, in our exposure, begin, most of us, to be a little more vigilant, maybe a little more fearful, maybe view people as a little less safe than we used to. So it really can shift how we view the world. We have been drawn to attention, though, that for many of us, we also experienced trauma before we even began this work. And so we knew the world was safe. We knew people weren't safe before we started the work. And the work has only reinforced or confirmed that view. So just recognizing that this change in worldview is something that does happen to all of us. Then we think about secondary traumatic stress. That's more of the acute reaction to knowing about an event or series of events that a survivor has had. What we have seen is that, that experience this can be a combination of our own life experience, what our day, our month is looking like, where is our support, what's happening in our agency, so that the secondary traumatic stress, what we often think about is that those are the external symptoms, if you will, parallel to post-traumatic stress that we can begin to experience because of that exposure to the traumatic events of survivors. Compassion fatigue is a term that really was used first off synonymously with secondary traumatic stress, and now we see it really used even more, I think, in medical, and many of you may attest to that. Nursing uses this a lot, and it's often accompanied not just with traumatic events in the way that secondary traumatic stress does and vicarious traumatization, but it's that physical, emotional, and spiritual depletion that is associated with caring for people with significant emotional pain or distress. So it certainly applies to those of us who are working with domestic violence and sexual assault and other survivors, but you will, when you're talking in the medical world, often hear compassion fatigue. And in fact, I worked at one point with a group of nurses who said they didn't need any help with secondary traumatic stress, but in fact, the next week they had a presentation on compassion fatigue, and I thought, well, wait, what happened? We just missed each other. So sometimes this language divides us rather than brings us together. Some of these terms apply more to acute experience, some more to a cumulative experience, and it's important just to recognize the work exposure to trauma impacts us. And as you'll see in a few moments, it's both positive and negative. Burnout is another term. We just want to always talk about burnout because it's not quite the same thing. Our experience of secondary trauma can result ultimately in burnout, but burnout can happen in any field. It's a state of physical, emotional, mental exhaustion that is caused by a long-term involvement in an emotionally demanding situation. And any profession can experience, it can ultimately require us to leave the work. It's not, it's Friday, I'm burned out, I need a weekend. It may be that I can't answer phone calls anymore, I can't talk to another survivor, I need a leave of absence, or I may need to leave the field. So it's really important to recognize that this, like some other terms, are thrown around and they don't always kind of hit the mark, so to speak. So when we think about vicarious secondary trauma, compassion fatigue, what is important to recognize is that there are some risk factors that we see in this next slide. And there isn't consistency within the research, but let me touch on a little bit of that. There are personal qualities, particularly that have been attended to, and the trauma history is one that's most often recognized, that in fact history of trauma leaves those of us in the field with more of a vulnerability to secondary traumatic stress or vicarious trauma. But in fact, at least in one of the studies, Slattery and Goodman, and some of you have worked in late 2009, late 2000s, in taking a survey that Suzanne Slattery and Lisa Goodman put out in the field. They interviewed 148 domestic violence advocates. And what they learned was, in fact, it was the trauma survivor in the field who held on to the empathy and compassion throughout their work in a way that wasn't always held on to by everyone. So it highlighted, in fact, we aren't simply triggered or distressed if we are a survivor. In fact, our survivorhood may inoculate us in a way that can be really helpful to engage or maintain our empathy. Doesn't mean we don't have our struggles, but it's important to recognize it can be also really helpful. What you see listed out, and I'm not going to read through everyone, but I want to highlight also how important it is that earlier advocates in the field with a heavy dose of trauma, and that's what many of you do day to day. You're talking to survivors, you're seeing survivors. It's important to recognize that that leaves all of us vulnerable. And the younger or the more junior, so to speak, you are in the field, especially if it's partnered with some of these professional factors, we are at higher risk. So if you're not getting supervision, if you're really isolated, if you haven't been trained up for your role, those all are risk factors. And you'll see us highlight as we continue how important quality supervision is, peer support is, having a voice in your organization, and also, yes, just being connected, not getting isolated. And I'm speaking really to those of you I know who are in the field and on your own, whether you're in a program, whether you're in a police department based whether you're based in a court, you may be the only advocate there. And it adds an extra layer of pressure on you and an extra level of risk. We're going to look a bit both at personal and professional examples. And some of you have seen this if you've heard us present, but we really do think it's important to take a personal inventory, and we'll be talking about a professional inventory as well. But it's important to recognize that just as we are multifaceted people, we are affected in many, many different ways. And so maybe you get headaches like I do, or you feel powerless, or you start to check out with friends or family, or maybe you're feeling a little less attentive to your work. Look for a minute, reflect for a minute. Do you see yourself here? You could raise your hand, or you could say yes or no in the chat box. But think a minute, where do you notice the impact of vicarious traumatization on you? And it may be that you think, oh, you know, my stats are due, we're understaffed, I'm on call a lot right now, I'm feeling pressure. You think about it as stress. But what we also think is helpful is to really think, what about the work and the exposure might be adding that extra level of vicarious trauma or stress on you. And just as our focus is on organizational, we're going to move to the professional exposure and really recognize you see the effects in morale, in behavior, in performance and relationships. And take a look here and see when you're feeling particularly overwhelmed with someone's story, or you've been to court, or you've been out in the field and you're just pounding out the work. Are you feeling less confident? Are you feeling like you're the only one who can do it? You better just suck it up and keep moving? Do you show up a little late? You know, how does the work continue to play out, and maybe others begin to notice it even before you do? I really appreciate raising the comment, the sleep being disrupted. Many of us see that. Some of you may see this disconnection that we've talked about. Maybe some of you have disrupted dreams, disrupted nightmares. Maybe you find yourself kind of hunkering down in different ways that you know you aren't as, you just know you're checked out a little bit. Maybe let me just say that. So it's really a time, it's easier if I had you up together and we were doing an exercise together, but we encourage you as we raise these questions. Thank you. Also, it is hard to get a little discussion going, isn't it? Sleeping is really a tough one, and we could have a whole discussion about sleep for sure, because sometimes it's just nice when it's finally quiet to stay up too late because you get a little peace, but then you can't sleep because you're thinking about what's going on in the day or what you need to do next. So just think a little bit about, you know, how many cheese pizzas have you eaten? That's my comfort food. How many, you know, times have you said no to social events, or you found yourself kind of pulling back, maybe from answering the phone, maybe not getting together with coworkers in a way that you used to? Thinking about both the personal and professional ways that the vicarious traumatization can play out. Now, we can't just talk about the negative and just about how you might feel like you're suffering right now. And let me say, though, that this doesn't go on all the time. If it's going on all the time, I want you to check in with us or check in with a colleague or your supervisor, because what we often see is that it comes and goes. So the change in worldview, chronic, it's an ongoing, but this sleeplessness or the pulling back from others, we hope, I guess this is a way to say it, we hope that is isolated and it comes and goes. And in fact, you may be really connected to the clients with whom you're working, the people with whom you're working. And it may be one story that stays with you, even though every survivor with whom you were working, you felt really connected to and you were doing really good work with. It may be only one story for whatever reason may be impacting you particularly. So what do? What we need to do is we do need to do some self-care. And self-care sometimes sounds awfully soft, and yet self-care is pretty important. There are some key strategies at the personal level and the professional level that are really important. And let me just highlight a few. If you were here with me, we would go through a whole exercise on this, but I want you to think a few minutes about who has your back, who's there for you, whether that's at home, in the community, or at work. Those relationships are key to sustaining yourselves. What about being creative? Don't tell me you're not creative, because we're all creative in some way. Do you cook a great meal? Do you sew? Do you collage? What is it you're doing that kind of stirs up your creative energies and really absorbs you so that there's almost nothing else you can focus on? And that's a process called flow that we often try to kind of hold on to, that we really are focused on something that challenges us just enough, but we're in it. Some of you find it maybe playing a game or a puzzle. There are many, many ways to find ourselves and sustain ourselves creatively. Eating healthfully, I'd say most of the time, is pretty important. Hanging out with friends, someone just raised, thank you so much. Dancing, running, exercising, stimulating our bodies in all kinds of ways is great. And sleep. Again, I can't emphasize trying to get what you can, the sleep that you can. I know it's more difficult when you have other responsibilities. Do think a minute and please join us in the chat room or the chat box if you want to offer some of your strategies. Maybe it's going out to lunch with colleagues. Maybe it's going for a walk. A walk, if you work downtown, maybe you walk around the common or the public garden. Meditation, we know from research how much meditation is doing for us, helping us to calm our minds, laughing with coworkers, playing with your young kids, often kids just absorb us. Our animals absorb us. Karate, for some of you, absorbs you. So think, are you doing those enough? And how can you do it? When we're so depleted from work, sometimes we're not able to do all that we would like to. Running with your dog, I love that. So we'll keep going, but all of that is part of self-care, but what I would say is it's really helping us to sustain ourselves and helping us really consider what resilience is. And what you'll find us talking about quite a bit now is not simply self-care, but really increasing our resilience, which is what a good self-care plan does. It helps to engage us. It helps us. Our resilience is being able to adapt, be nimble, I think of, in the face of tragedy, trauma, significant sources of stress. So it's being able to bounce back. And increasing our resilience is really what some of those self-care strategies are about. If we're taking care of ourselves in an ongoing way and we're getting encouragement from our peers, our partners, our workplaces, then we really can go at it and the work. We can really do the work. And we can bounce back even in the face of the most horrific experiences of the survivors with whom we're working. And one of the things we've been learning about is some of the good stuff that comes from this work. And in fact, vicarious resilience is one of those things. And I love that people are continuing to speak in the chat box about what you're doing. And we may get some new ideas about how to sustain yourselves. Playing a little music quietly at work isn't a bad thing, I would say. Music, really, what music brings you up, what music settles you down, all good to know. One of the things that researchers who are working with survivors of torture have helped us to understand is vicarious resilience. And the work can increase our resilience. We can be inspired ourselves. Many of us have worked with domestic or sexual violence victims who actually have been tortured. But whatever their experience has been, we too can gain from their resilience. We have seen people who, because in the face of their trauma, have not simply survived, but they have been able to really bounce back even in a stronger way than they ever could have imagined, and sometimes than we could have imagined. And so what vicarious resilience is, it involves learning about overcoming adversity from trauma, from the trauma survivor, and the resulting positive transformation. The impact is huge. And in fact, as we think about those survivors who have been resilient, and again, the people who have gotten through, getting through is really laudable, but then think of those people who have gone even further in how well they're doing now. And as we reflect on their experience, and in fact, you might reflect right now on someone whose trauma and their resilience in the face of that trauma really inspires you. And as we reflect or even meditate on their experience, we can gain our own perspective and appreciation of our problems. We can have an increased sense of hope and really, again, gather, really gain an even further sense of the meaning we have in this work. So vicarious resilience is one of the positives. Other positive, and I jumped ahead a little too quick, but two of the other terms we use and we don't want you to lose sight of because we often focus on the negative is how good it makes us feel, and in fact, how much pleasure or satisfaction, maybe pleasure in the relationships of working with survivors, and really satisfaction in the meaningful contribution we're making to their lives and to our society. Vicarious transformation is an ongoing, intentional process by the worker that results in a deepened connection with others, a deeper appreciation for your life, and a greater sense of meaning and hope. And this all comes from Lori Ann Perlman, the psychologist researcher who brought us the phrase vicarious traumatization. And I'd ask you to think a minute as we move into the next slide to recognize the positive impacts of the work on you, and also the ways that you've recognized resilience in some of the people with whom you've worked. Think a minute about what has recently brought you some satisfaction, maybe something you've heard, maybe a way that a survivor has moved in their life, and just ask you to think a minute about that experience. And maybe if you want, you could also say a word or two in the chat box about what was it about the resilience of someone with whom you've worked. What is it that you hold? You know, I hold on to the tenacity of the survivor with whom I worked, with the focused thinking she had in the face of a real traumatic event. And so many of us can think about perseverance, the strength, really in the face of pretty horrible events. And why this is important to focus on the good is because what we pay attention to grows. And neurons that fire together, wire together, as you heard from Erin. So that as we focus on the positive, we also are building that muscle of really focusing and seeing the positive as we go. So we've moved in, yep, that's why this is important, bringing conscious attention to resilience and vicarious resilience. And I'm going to move us even to the next slide, which is why, as we in the Vicarious Trauma Toolkit have really wanted to bring forward the range of experiences that one who's working with trauma survivors can have. And so we have taken this exposure to trauma, which all of us had, to be vicarious trauma. We have the change in worldview. This chart reflects this conceptualization that really has guided our thinking as we've moved forward. And so you've got the inevitable exposure, you've got the processes of change in worldview, and then another series of affective and behavioral responses. And the negative we've seen quite a bit of, right? We've talked about the vicarious traumatization, the burnout, the PTSD. We also are learning more about the positive that I've also reflected on right now. And in fact, what we're proposing also is that there can be a neutral response, that there can be weeks and months where we're moving along well, we're sustaining ourselves, and the work isn't pulling at us in the negative way that maybe we've experienced before. And so one of the things we are thinking about even more is that maybe in our resilience, in our experience, and in the support and coping ourselves and within our organizations, that we can have less of the negative and more of the neutral and positive. So as we think and move in more to organizational, I just want to spend another quick minute on knowing you all walk into work every day. You don't always know what's going to happen, except that maybe you're going to court, maybe you're going to an organization with someone, maybe you're going to sit with someone, and there are going to be many hazards hanging around. And what we want to do is focus in on organizational response now. More quickly, I'm going to keep moving right now. You have the slides because I'm running out of time and I'd like us to go ahead into the toolkit. You can read, let me keep moving if we could. Please, we'll move through this. Let's move on to the next one. What we do know is that this work impacts all of us, and some of the prevalence work, the prevalence studies, have been done in an array of fields. Child welfare is one of the ones that has quite a bit of study that's gone on, but that you, wherever you are, have both the potential for direct exposure as well as indirect exposure, and that sometimes that exposure can lead us to have symptoms, if not fully diagnosable PTSD. Let me move us forward again just to wrap this section up. Just to close, nope, go back one please, that as we move to Janet's time, what we want to reinforce is that identifying what the impact is really important. Recognizing that self-care isn't everything, that we want to focus both on what we can do as individuals, even within our organizations, but also part of our mission with the Vicarious Trauma Toolkit is to really say this is an issue, this is a real issue for our organizations to grapple with. You heard about it in the last session, and you'll hear more about it now, some of the tools that we've gathered. We really feel organizations have a responsibility too. And I'm going to pass it on to Janet now. It will take us just a minute. Thank you. And maybe we'll take a few, I'm going to pass it on to Janet unless there's a pressing question, and then we'll take some questions at the end.
I need a headpiece. Oh, I need mine. I'll put mine. Okay. I'm assuming people can hear me. So good afternoon. And we kind of wanted to sort of make this shift now to talking more specifically about sort of the organizational response. And a lot of what Lisa was talking about thus far was information that certainly has been out there that you have certainly participated in other of these sessions, but also that has been out there in terms of growing understanding and knowledge about the impact of exposure to the trauma of others, vicarious trauma, all of the terms that Lisa was discussing. But I think we all sort of acknowledge that while there was sort of a growing understanding about the work that we do and our immersion in that work with survivors, there was more of a focus on sort of the individual responsibility and less of a focus on sort of the organizational responsibility. And so there was, for our work with the Vicarious Trauma Toolkit, there was really this groundswell of interest in exploring the other part of the spectrum, so to speak, the organizational response. And not to say that the individual response or the notion of individual self-care is any less important or less meaningful. In fact, it's critical to our own ability or our own empowerment of our own well-being and health and well-being. But we also wanted to kind of shift the focus such that organizations started to recognize, organizations that employ people who are chronically and cumulatively exposed to trauma, that they take on the duty and responsibility to address it, both in terms of organizational response, but also on work time, so that it's not seen as a responsibility that an individual needs to do when they're not involved in their day-to-day work or in their leisure time, etc. So part of what we know is an important place to start, that for organizations like yours, our guess is that kind of making the case for why this is important organizationally is probably not that significant, but we can tell you that working with a lot of first responder agencies and organizations and victim service agencies across the country in this project, that many that have requested some training and technical assistance from us along the way have said that there are some people within the organization that understand the importance of addressing vicarious trauma, understanding the need to raise awareness about vicarious trauma, to kind of remove the notion of sort of that it's a taboo subject. And to sort of make the argument to their leadership that addressing it as an organization is important. So I think in some ways, victim service agencies are a little bit ahead of the game, but what we actually found was, and as we'll talk about a little bit more, was that actually some of the first responder, you can go back one, go back one slide. Some of the first responder agencies and organizations had a little bit of a leg up on victim services in this regard. And so actually one of the tools, while most of what is in the toolkit are tools and resources that were already out there in the field and that were identified and submitted and collected and collated and vetted and et cetera for use in the toolkit, there were some gaps that we identified through a gap analysis. And one of them was, how do people within an organization make the business case to their leadership? And so there is this is just an example of one of the new tools that we created for this toolkit, that is guidelines that and sort of talking points and information that really help to make the business case, so to speak. So the business case comes from understanding the fact that there are, in addition to all the individual impacts that that Lisa was talking about, and some of the professional impacts, that organizationally there are ways in which organizations are impacted. And I think actually, if you go back one slide. So these are the many ways in which organizations are impacted that really have a direct impact on the staff that are performing all of the roles and responsibilities, but also really makes an organization as a whole less productive, less able to deliver high quality services over the long haul in a sustained way. And we sometimes look at agencies like those that you work in and that Lisa and I have certainly worked in, that there's a significant amount of staff turnover. We often attribute that to the fact that they're not particularly high-paying jobs or other things, but we haven't probably paid enough attention, and this is certainly what we've gleaned through our work in this project, that staff turnover may be due to some of those things, but it also may be due to unaddressed vicarious trauma that isn't kind of addressed in a sort of more sustained organizational way. Okay, now you can move ahead and go to the next slide. So as part of this, we wanted to give you, not just to give you a great deal of detail about what it took to build this vicarious trauma toolkit, but really there was a lot that we learned through the process of developing it with our first responder partners and our victim service partners across the country. So next slide. So this was a project that was funded by the Federal Office for Victims of Crime, which many of you are familiar with because they're the source of VOCA funds, et cetera. And typically, as you may know, OVC is responsible for funding direct services, so victim assistance, victim services, direct victim services, and supporting victim compensation efforts on the state and federal level. So this was a bit of a shift for OVC to fund something that wasn't really immediately seeing survivors as their beneficiaries. They was sort of they were really going to be ultimately the secondary beneficiaries of this kind of a project. But it was through their recognition of what Lisa was talking about earlier, about even the change in the DSM to recognize the impact of indirect exposure, the lessons learned from many of the mass violence responses and incidents that were experienced in different parts of the country, and also recognizing that while there was some understanding about vicarious trauma out there, there wasn't one central repository, one place that people could go to find the kinds of resources that they needed to address it. And so I think OVC really made the connection that if we're able to make agencies and organizations that employ those who provide care and assistance and support to victims and survivors, that victims and survivors would be getting much higher quality care and much more sustained higher quality care. So it was interesting that, and certainly significant that OVC chose to create something that would be for the caregivers themselves. And so through the proposal that we submitted collaboratively, it was to create this web-based toolkit that could be resources, the best of the resources that we found out in the field that are currently being used, and to create some new tools that really would help organizations and agencies to build their capacities in this area. So just to give you a sense of what the focus for this was really on not just victim service agencies, though it was significantly on victim service agencies of all kinds, serving all different kinds of victim populations, victim and survivor populations, but also for first responders, recognizing that those first responders often are at the same time or before, during, or after victim service involvement are also engaged with victims and survivors. And so the first responder sort of disciplines that we were focused on were law enforcement, certainly ones that we end up working with or collaborating with or being challenged by or having professional conflict with, and victims and survivors having to navigate law enforcement and criminal justice systems, but also those in fire services and emergency medical services. And while that was the focus for this toolkit, we recognized early on, as did we get this kind of feedback from the field, that within each of those, we could certainly make this toolkit relevant to a whole lot more professionals in different venues, in different arenas, so that it wouldn't be just EMS, but it could be emergency room, healthcare providers, it could be SANE nurses within victim services, it could certainly be child welfare, within law enforcement, it could be corrections and prosecutors and on and on. So we recognized that while it was limited to those particular professional disciplines, that it really had relevance, and we were looking to make it have relevance to a broader array of people who are working with and serving victims and survivors. So this slide really shows the depth and breadth of the team that worked on this project. Our local team that was Northeastern University was the lead on this project, and then the BI program and BARC were involved on the sort of on the Massachusetts or local part of the team. And then the national partners, in order to even apply for this grant, we had to have national partners that represented all of these disciplines. So we worked very closely and collaboratively with the International Association of Chiefs of Police, other organizations that I didn't know really existed, like the International Association of Fire Chiefs, the National Association of State EMS Officials, and then of course the International Society for Traumatic Stress Studies, and then 2 national victim service agencies, the National Center for Victims of Crime and the National Children's Advocacy Center. So all of these partners, both local and national, really helped us to amass the contents that you'll hear a little bit more about shortly for this toolkit. And we really prided ourselves on saying this needed to be a project that was developed by the field for the field. And so there were a number of different ways in which we really tried to identify what resources people in various different organizations were currently using to address the issue of vicarious trauma, excuse me. And we did that through a national survey that I think many of you may well have participated in. All of our national partners and local partners helped to disseminate this survey, so we did receive a significant response, more than even anticipated, which actually told us that the need for this was so great that people really had a very significant interest and commitment to seeing something positive come from this project. We also had somebody from the law enforcement community who was very immersed in vicarious trauma response, having experienced his own significant issue of vicarious trauma, working in law enforcement, and who was lending his significant experience to this project. We held 2 national expert summits with representation from each of the participating agencies. We pilot tested a rudimentary toolkit. So early on, once we sort of put together a sort of early on version of the toolkit, we pilot tested it in 7 diverse communities across the country. And those communities applied to service pilot sites. They had to apply with a team of representatives from each of those disciplines. So while that didn't require that they be working on issues of vicarious trauma collaboratively in their own communities, we did want representation from each of those 4 disciplines. So within very rural western counties in New York State, Austin, Texas, Asheville, North Carolina, Cambridge, Massachusetts, woohoo, Chicago, Illinois, Glendale, Arizona, and Great Falls, Montana, all were representative of diverse geography, demographics, and with different strengths and sort of weaknesses, so to speak, of the different disciplines within their communities. So that really helped us to figure out how this toolkit was going to become very relevant for all of those disciplines and in different diverse communities around the country. Next slide. For this survey, if you want to type, I'm trying to read the suggestion. Oh, okay. For the first question, maybe is addressing vicarious trauma a priority for your agency? Maybe if you want to take a quick second to type in yes or no for that first question. Is addressing vicarious trauma, in your opinion, a priority for your agency? And part of the reason for asking these questions, you'll see shortly, is these questions were part of the national survey that that went out to that we got responses from over 8,000 people. So I see that yes, very much so. We could be doing more, and I would then ask, does your agency, and maybe just combining. Three, does your agency currently have formal policies and practices or informal practices to address vicarious trauma? Good point about the anonymous. So maybe we will just have you answer these questions to yourself, because that's a good point. Thank you for raising that. But just think to yourself about this issue, about priority, about, and in fairness, the surveys were anonymous, so people were able to answer these questions anonymously, and we did receive responses from different levels of responsibility within agencies and organizations. But maybe then to move to see what the results were based on what you're thinking in your own minds, but move to the results of what came out of the survey, the national survey that we conducted. So the next slide. So in answering the question, is addressing vicarious trauma a priority? Interesting, you'll note that more than half in all of the disciplines said no or yes, but low priority. That, and victim services, I think we probably thought victim services were going to be ahead of the curve in this regard. And we did separate out, because there was a significant number of responses, though we captured children's advocacy centers in victim services, because there was a significant response from people involved in children's advocacy centers or multidisciplinary teams responding to child victims and families. We were able to separate those out because of their identification of their affiliation as such. But even with that, you'll see that low priority or not a priority really received a significant percentage of the response. The next slide. This is, does your agency organization have formal practices that address vicarious trauma? And again, you can see that the significant portion was really answering no to formal practices. But then if you move to the next slide, the next slide speaks to informal ways in which an organization might be addressing vicarious trauma. And you'll note that there was significantly more positive responses to this question, because in fact, this was sort of part of what the learning process was around this project, was that there may well be things that agencies and organizations are doing to address vicarious trauma, but not necessarily sort of woven into the fabric of the organizational structure or policies or procedures, et cetera. And so that was one of the things that we knew we needed to address in this toolkit. The next slide. So one of the other questions that was asked of people in the survey was if their agency was missing or could do more, as one of your responses was, if your agency was missing certain kinds of formal responses that you believe are necessary to address vicarious trauma, what were the obstacles to obtaining them? And so, probably not surprising to anybody, lack of resources, funds, staff, time, etc., was the most significant. But then also lacking support, which sort of links back to that issue about making the business case or getting leadership on board early on to help to guide and to reinforce the importance of adding this to the notion of being a trauma-informed organization, and also to it being a significant part of the organization's mission. So next slide. So after several years of gathering a lot of resources from the field, doing an intensive literature search, research literature search, internet search, and gathering from individuals who were willing through the survey or the pilot testing process or other mechanisms to actually send in sample policies, procedures, practices, programs, websites, podcasts, and videos. All of those that were submitted, there was an extensive process by which they were reviewed and coded for whether any had evidence base, which we learned pretty quickly. There were very few of the strategies out there that have been tested enough to really be considered evidence-based. But there were many that were evidence, or some that were evidence supported, and some that were then deemed promising practices. And so it was really those that were identified as the more priority resources to be included in this toolkit. And then, as I mentioned earlier in talking about the guidelines for making the business case, through this process, we were also conducting a gap analysis, which really meant that we were asking people, what resources would you feel like you really needed or would like to have that you don't think exist? And then certainly if we identified what we had and where there were gaps in what was needed, we created about 16 new tools for agencies and organizations to use. So a couple of the things that if you haven't already visited the toolkit, then we certainly will reinforce the importance of doing so and really exploring it. One of the things that we created for the toolkit to kind of make this issue become more personal, come to life more for people in different agencies and organizations was to use some of the people who were our national partners, but also people from the field, from our pilot sites, to create some very short educational videos. And so I think we have time to show one of them. Okay. Oh, let's see here. Okay. Oh, can you click on the victim services one, please? You'll recognize some local people in this as well, if it's able to come up. Maybe does it seem like it is connecting? This is actually, it was difficult to connect through this slide to the toolkit itself. So this is going to where it's posted on YouTube. If it's not coming up, we can certainly move on, and then I can just direct you to look at these videos on the toolkit itself.
Oh, yes, connect.
Oh, here. I think you need to back it up. If you back it up to the there. Is there sound? If there isn't sound, we can. Yes. Okay. All right. Maybe we can go back to the slides. It sounded like some may have heard it and others not, so I apologize for that. But it is on the homepage of the toolkit itself. So certainly invite you to see both the one for victim services and for first responders, because I did think that we have discussed the fact that understanding also what our colleagues in other disciplines are also experiencing may sometimes help us to better understand where some of the difficulties emerge in our work with survivors. So if you can go to the next slide. So what we started to talk about as we gathered all of this information from different people from all over around the issue of vicarious trauma within the context of organizational response was to look at what we could find that was evidence supported or evidence based. And that really came from kind of organizational psychology literature. And so we used some of that to inform how we were going to think about the building blocks that organizations and agencies needed to put in place in order to become a vicarious trauma-informed organization. Next slide. So this is the definition that we came up with for the toolkit, to what is a vicarious trauma-informed organization. And we thought of this, we talk very frequently, it's become kind of common practice to talk about trauma-informed services, trauma-informed organizations, etc. And we saw vicarious trauma-informed as being part of that, because ultimately, if we are vicarious trauma-informed organizations, we're going to be able to deliver the higher quality services and more sustained higher quality services. So the definition was a vicarious trauma-informed organization recognizes the potential negative consequences of the work and assumes the responsibility for proactively addressing the impact of vicarious trauma through policies, procedures, practices, and programs. So things that organizations need to embed within their agencies and organizations to address the needs of their staff. The next slide. So these were the areas of focus that we ultimately sort of identified as the building blocks for building this vicarious trauma-informed organization. And it also became the areas of focus for the central tool that we created for the toolkit, which is called the Vicarious Trauma Organizational Readiness Guide, or VT-ORG. And that guide is an initial organizational assessment tool that does two key things. That helps agencies and organizations to identify what their strengths are in each of those areas of organizational health. And also once gaps are identified, so identifying strengths and also gaps, and once the gaps are identified, to be able to then use those gaps to guide the exploration of the toolkit to find resources that would help fill those gaps. And so that was sort of the dual purpose that we had in creating this organizational assessment tool, the VT-ORG. So for each of these, and we're probably not going to have enough time to really go through each of these categories, but we wanted to be able to give you a sense of what each of these categories focused on. So the first being leadership and mission. And for each of these categories, there's sort of a purpose statement that helps agencies and organizations understand what the focus is, why this is important. And so for leadership and mission, that statement, it says, to address the impact of vicarious trauma, leaders in vicarious trauma-informed organizations proactively integrate strategies into workplace values, operations, and practices, maintain a clear vision that supports and articulates the agency's mission, and regularly models and promotes open and respectful communication. So those were the key areas of focus. And within each of these categories, there are then some very concrete measurable statements that people in the agency and organization can rate on a sort of a Likert scale from never, rarely, sometimes, often, always. So along a continuum like that, to be able to identify what the agency and organization is already doing and where some of the gaps are. For management and supervision, this is about managers and supervisors fostering supportive relationships based on inclusivity, mutual respect and trust, promoting policies and practices that lessen the negative impact of the work, seeking out and supporting staff following critical or acute incidents, and conducting performance evaluations that are inclusive of addressing the issue of vicarious trauma. So those are the key area of focus for management and supervision. For employee empowerment and work environment, this was, and Lisa referenced some of this earlier, but in order to promote and maintain a healthy work environment, and this is not just a physical work environment, though inclusive of that, a vicarious trauma-informed organization needs to foster teamwork, encourage collaboration both within and outside the organization, create formal and informal opportunities for staff to connect with one another, and offer opportunities to diversify job tasks. Because we know that when people become overloaded, the opportunity to do more preventive work or to do community outreach or to participate in community collaborative meetings or committees, etc., really contributes to the ability to refresh and be resilient. So that's sort of the area, and also ensuring, as Lisa I think referenced before, the notion of being able to understand policies and procedures that organizations implement, but also to have input into those so that there is sort of almost like a 360 opportunity for feedback loops. For training and professional development, it probably seems like self-explanatory, but it's about a few different areas. To strive for professional competency, capacity, and staff retention, vicarious trauma-informed organizations promote continuing education, professional development, and networking opportunities. Actually, before even the continuing ed, to start off by providing thorough orientation and training when somebody first comes on board, enabling people to have access to the resources they need to do their jobs, and to support staff participation in on-site, so in-service training, and also off-site learning opportunities. And the notion being that it really needs to be embedded within from the time somebody gets hired, even during the hiring process, to when they come on board, to when they're oriented, so that the issue of vicarious trauma is recognized and spoken about and addressed from the beginning and throughout their involvement in the organization. And then finally is, certainly not last but not least, is the notion of staff health and wellness, which really encompasses the notion of devoting time and resources to promoting staff well-being, encouraging and providing health and wellness activities, and that's whether they're provided during work hours or even supported when people are off hours, and incorporating wellness into policies and practices. So those are the 5 areas of organizational health that are reflected in this organizational assessment tool, and the toolkit itself can be explored within each of these categories. So if one category in particular, one aspect of a category in particular is identified as an area of need for an agency or organization, the toolkit can be explored by that area, by that category, to look for, to have a more streamlined way of identifying resources that others have used to address that particular issue or need. And so if you move to the last, getting close to the end of the slides, we're almost there. This is actually a screenshot of the front page of the Vicarious Trauma Organizational Readiness Guide, or VT.org, for victim services. There is a similar document for each of the 4 disciplines, so law enforcement, fire, EMS, and victim services. It's essentially the same thing, but with some language differences to reflect the different types of cultures that each of those disciplines have. But the reason that we wanted to show this is that there are many different ways in which an agency and organization can actually use the VT.org. Some agencies that are very large have really formed a committee to sort of help decide how to implement it. Some everybody at all levels of the organization have completed. Some have ongoing advisory groups with staff representation from different levels of the organization to help guide not only the assessment, but also then the development of an action plan. And so there are many different ways in which agencies and organizations, depending upon their resources and size, et cetera, could implement this organizational assessment tool. And then there's also suggestions about once the organizational assessment tool is completed and the results are tallied, that there's some scoring instructions that can be provided, and also there's recommendations about ways in which the results of the assessment can be delivered to the members of the organization and to help contribute to the development of an action plan. So next slide. So we just kind of wanted to end with this cartoon and sort of our wish for each and every one of you as you do the work that you do each and every day, but also as you hopefully embark on more of this journey with becoming vicarious trauma-informed organizations. And so here you see this person in the cartoon saying, I'll have a large order of personal fulfillment and a glass of self-respect with peace of mind on the side. And I think that's what we're all striving for as we do this really important work day in and day out. So, well, yeah, so there's the resource information about the toolkit, and then certainly for any information, inquiries about training and technical assistance, Lisa and I both can field those. And we do currently have a graduate student working with us at Northeastern who is looking to create the evidence for the organizational assessment tool through his dissertation work. And so he is available for the next couple of months to be able to assist agencies and organizations in actually implementing the organizational assessment tool and doing the implementation and the results, the analysis of the results, and being able to deliver a report back to the agency and organization. So he's able to take some additional requests for that type of assistance, which will ultimately lend to his dissertation work, which I think will be a significant benefit to all of us. So I think we have a few minutes for some questions. I know that was quite a mouthful from both of us, but we're happy to take some immediate questions.
As we're waiting for some questions, Lisa and Janet, Dana and I are sitting here and just really appreciating this presentation. And I did want to sort of comment that at the Initiative for Safety and Justice at Jane Doe, we have an advisory group, and Janet and Lisa are part of that. And we've had some conversations about ways of convening potentially this fall some programs that are interested in talking more in depth about the toolkit and how to use it. And I think that's really incredible that we have you here as a resource being willing to do that. So thank you. Let's see, do we have a question?
If I can just add one thing that Lisa has alerted me to is even after this grant we're in the phase of this project now where we are doing dissemination, where we're speaking at a lot of national conferences and other kinds of trainings, providing some technical assistance to agencies and organizations that are looking for that. And even after the toolkit project, the funding has completed. OVC has their own Training and Technical Assistance Center, which many of you may be familiar with, OVC TTAC. And TTAC will be picking up responsibilities for continuing to provide training and technical assistance to agencies and organizations looking to utilize the toolkit and to become more vicarious trauma informed. And among the trainers for TTAC will be those on our Vicarious Trauma Toolkit team, including Lisa and me and our other colleagues. So the opportunities for training and technical assistance will continue beyond the life of this funded project, so to speak.
The project goes through the year, through September.
Yeah, through our grant funding currently, our training and technical assistance is happening through the end of September. We may have the ability to extend it a bit beyond that into closer to the end of the calendar year. And then again, beyond that, we may have some flexibility about doing it beyond that, but then OVC TTech will be picking up the lion's share of the training and technical assistance requests around the use of this toolkit and becoming Vicarious trauma informed.
Well, Janet and Lisa, we really want to thank you for your time today, spending your time sharing this project with us. And I put in the chat for everyone just your email addresses as another contact person, and we also the link to the evaluation for this webinar. What we're really interested in hearing back from you all, any questions that you have, Jana and I would be happy to answer them, but certainly reach out to Janet and Lisa as the experts on Vicarious Trauma Informed Toolkit and the resources that you may need in your program. And we're hoping that this really today was a beginning dialogue that will continue. And so we're looking forward to that and really want to thank you again, Lisa and Janet, for being with us.
I just wanted to say thank you so much for having your cameras on. I really appreciated that you were open to use the video camera so everybody can see you. It's kind of nice to put a face on the trainer. Sometimes, you know, not everybody feels comfortable with that, and so I really, really appreciated that you make the effort. Thank you so much for that.
Yes. And thank you to everyone for being with us today for this last hour and a half, and we'll look forward to being in touch with you moving forward.
Thank you.
Thank you.
Thank you, everybody.
Have a good afternoon, everyone.